Hi, Dr. Michael Miyasaki from Miyasaki Dental. Today we're going to talk about early detection. Early detection is crucial because the longer you have a dental problem, the more damage that can cause. So what we're going to talk about today is what we call BLISS. BLISS imaging helps us see what is essentially invisible. And by seeing what's visible, we're able to communicate better with our patients and show them what's going on in the mouth to prevent bigger problems. The key is red is bad. So how do we see the red? What you see here are four different cameras. This is like a large camera where we can take pictures or photos, images of a lot of teeth. Then this one looks like a little wand that helps us to see smaller areas, like areas inside the patient's mouth. Then there's another that looks like a wand that's basically like a flashlight. It helps us see the bacteria in the mouth. And then there's a little unit that's kind of like a camera. And patients can even use this at home, hold it up to the mouth and use the mirror to see through this little special screen here, and they can actually see the red. So what am I talking about when we talk about red? Well, here's a patient that has braces. And when you have braces and all the wires and the attachments that attach the wire to the teeth, we call those brackets, it's very hard to clean. And when it's very hard to clean, patients, because usually they're younger too, get a lot of plaque built up around the brackets. If we leave that plaque there, which is basically bacteria, that bacteria can actually weaken the tooth there, causing either cavities or at the minimum what we call white spot lesions. That means when we take all the wires and the brackets off of the teeth, you'll see these little squares around where the brackets were, where that bacteria was just adhering to the teeth, causing the tooth to get weaker. Well, with our cameras that we have now, we can show the patients where the red is. And now I can tell the patient, hey, look at where the red is. That red is where there's bacteria, and that bacteria is harming the teeth. What I need you to do is at home is make sure you get all that bacteria off. And either they have to just visualize it, look really closely in the mirror, or they can use that little home unit in order to see where that red is. This is a tooth, and the teeth have these little deep grooves. And in those deep grooves, what we often do is we look to see if there's deeper fissures or cracks, valleys down that tooth. But when you look at it with the white light, those grooves look sort of normal. But when you use our special lights, you can see that the red is in the cracks, and it actually goes under what we call a cusp tip. It's one of those little bumps on the tooth. And when we would take our drill in there, we'd actually find that underneath that portion of the tooth, there's going to be a lot of decay. You can't see it with the white light. You may not even be able to see this with an x-ray, but with this red light, this bliss light, we can see. Again, what earlier detection means is that when we have to take care of that tooth, it's going to be easier, we can be more gentle and more minimally invasive, which means we're going to save money, which is a good thing. Now here's a look at some teeth where you go, okay, what's bad with this? Well, I would tell the patient, you've got stain. We see the little brown spots of stain, but right at the gum line, there's plaque. Plaque is that white sticky stuff that sticks to the teeth and it harbors bacteria, but it's very hard to see. So what we do is we bring our red light in, and with the red light, you can see the red glow right at the gum line. And so this is where we tell the patient, I know it's hard to see in regular light, but look at all the red glow down here. That is where the bacteria is sitting right at the gum line. It's going to cause cavities in the teeth and gum inflammation and bone loss if we leave it there. So again, we can detect it earlier, we can communicate it better, and that means when we have to treat that gum disease, if we do ever need to do that, we can be more minimally invasive, we can be gentler, and it's going to be easier for you. So I started off saying we try to see invisible and show you what invisible is too. And we can do that with some of the new technology that we have. We call this biofluorescence-led intelligent screening system that detects disease earlier before it even causes damage. So we can show you areas that you can actually take care of before the damage occurs. In the long run, it's win-win for all of us. At Miyasaki Dental, we are really focused on the preventative care that we can offer our patients. We hope to see you soon. Thank you.